Good morning, everyone. Today I am excited to discuss a crucial aspect of human resource management in healthcare. My name is Rakhi Justin Sudha. My student ID 167391226. Here is my team member.
Hi, good morning. My name is Anne Maria Jose and my student ID is 167392224.
Hi, my name is Sandra. My student ID is 155198229.
Hi, good morning. My name is Bensimol Bensiga and my student ID is 155493224.
So we are moving to our topic, training current employees. This topic is of paramount importance as it directly impacts the quality of patient care, staff satisfaction, and the overall efficiency of healthcare delivery. So, introduction of the topic. As we all know, the training is essential for current employees as well as the new employees. Why it is very important? Because then only we can give quality care to the client, as well as it helps to the development of the organizations and the staff as well. For both individual professional growth and the enhancement of the overall patient care. As healthcare technologies advance and new technologies emerge, that ensuring that nursing staff remains proficient and up to date becomes paramount. So next we are going to discuss why is this a human resource management issue. As we know, because first one is aligning the organizational goal. As we know, when we train the current employees, it helps to align the organizational goal. How? Because the effective training and development are fundamental to ensuring the competency and adaptability of nursing staff. Human resource management plays a vital role in strategizing, implementing, and overseeing these processes. Human resource management is responsible for aligning the organization goals with the skills and knowledge of its workforce, making it imperative in the context of healthcare, where the advancement in technology and procedures are concerned. So, what are the organizational responsibilities when training the current employees during the invent of new equipment? There are mainly 5 responsibilities. First one is need assessment. Second is training program development. Third, integration with workflow. Fourth is resource allocation. Fifth is assessment and feedback. So I'm going to discuss the first two. Needs assessment. Needs assessment identify the specific skills and knowledge gaps among the nursing staff related to the new equipment. It will definitely help the nursing staff to improve their knowledge. How assessments will do by surveys, interviews, and collaboration with the department. Let's to pinpoint areas that require the improvement. Second is training program development. How it's training program development? Because first we can give the hands-on training. Second is simulations. Third is e-learning modules. So developing a comprehensive training program that covers the theoretical and practical aspect of using the new equipment. So we can use by these methods like a hands-on training, simulations, e-learning modules helps to give the training program development. So rest of the topic is going to discuss my team member Anne Maria. Thank you.
So I'm continuing with the topic dealt by Rakhi. Rakhi already told about the organizational responsibilities for training current nursing staff on new equipments. That's the need assessment, training program development, resource allocation, assessment and feedback, and integration with workflow. He has already told about the need assessment and training program development. So I'm continuing with resource allocation, integration with workflow, and assessment and feedback. First is the resource allocation. Resource allocation means we already know that there should be an allocation of resources that include the budget and the personnel that is mainly to support the training members or the training initiatives. And this may include the hiring the external trainers, investing in educational technologies, and providing sufficient time. Mainly the providing sufficient time for the staffs to undergo this training, and also without any compromising the patient's care. So that these are the main thing that is included in the resource allocation. Next is the integration with workflow. We should always ensure that the training program is seamlessly assigned in the workflow of the nursing staff. There should be an order in the training program so that all the staff members can communicate properly, so that there should be a flow of this training program. Mainly this prevents the disruptions in daily operations. Then the integration, or this integration will help to prevents the disruptions of the daily operations and allows for the immediate applications of the acquired skills. That is the integration with workflow. Next is the assessment and feedback. The assessment and feedback means that we are implementing some of the mechanisms for assessing the effectiveness of the training program. That means it will help to identify the areas that need further development or further attention. So these are mainly things we are looking in the assessment and feedback. So the responsibilities for training the nursing staffs are training program development, resource allocation, need assessment, integration with workflow, and assessment and feedback. Next, I'm going to deal with the laws and regulations of training. There are mainly 3 laws for the training. The first law is the Occupational Safety and Health Administration. It is also known as OSHA. Compliance with OSHA regulations is essential to ensure that safety of healthcare workers. Mainly, this law is ensuring the safety of the healthcare workers in order to do their activities in a safe manner. So that the training program should cover all the aspects that are related to the safe equipment operation, infection control, and the proper handling of healthcare or hazardous materials. That is mainly included in the first law, that is Occupational Safety and Health Administration, that is OSHA. Next is the second law, is the Health Insurance Portability and Accountability Act. It is mainly emphasizing the importance of the patient's confidentiality. We all know that the patient's confidentiality is one of the main things that is included in any hospital settings, so that we should always maintain the patient's confidentiality. So this law is mainly related to the confidentiality of the patients, and also it also includes the proper handling of the electronic health record systems. That means that this electronic health record system are interrelated or incorporating with the new equipments. These are mainly included in the second law, that is the Health Insurance Portability and Accountability Act. The third law is the State Nursing Boards and Accreditation Agencies. It mainly adhere to state-specific regulation of nursing practice, and also they are ensuring the training program aligned with the standards set by the nursing council or nursing boards and accreditation agencies. These are the main 3 laws and regulations for training. The first law is Occupational Safety and Administration. Second law is Health Insurance Portability and Accountability Act. The third is State Nursing Boards and Accreditation Agencies. So the rest of the topic will be dealt by Sandra. Thank you.
Moving on to the barriers, the first is the time constraints. In the busy schedules and demanding workloads, it may hinder nurses from dedicating time to continuous development activities. Limited time may result in a delayed or incomplete participation in training programs, hindering the acquisition of new skills and knowledge. Next is the resistance to change. In resistance to change, some nursing staff may resist adopting new technologies or practices due to fear of the unknown or a comfort with established routines. Resistance can lead to a reluctance to engage in training activities, hindering the integration of innovative approaches into patient care. The next is the financial constraints. Limited budget allocation for training activities may resist access to advanced education resources and opportunities. Nurses may face challenges in attending conferences, workshops, or pursuing further education, impeding their ability to stay abreast to the latest developments in the healthcare. Then, moving on to the next slide, we have the strategies. The first strategy is the flexible training schedules. As we all know, we offer flexible training schedules that accommodate different shifts and allows nurses to participate without disrupting patient care. This strategy ensures that all staff members have equitable access to training opportunities regardless of their work schedules. This is the flexible training schedules. Then the rest of the strategies will be continued by Ben Simon. Thank you.
So the next strategy that we are going to discuss in detail is about the budget allocation. And the main impact of budget allocation is that high quality educational resources, courses, and certifications addressing financial barriers to professional development. It is that we must advocate for increased budget allocation for continuous education and training initiatives. Hence, the trainees can get an advanced knowledge about what they want to do in their settings. Then change management strategies. And the impact of this strategy is that addressing resistance to change through effective communication and involving nurses in the decision making. That is, implement a change in management strategies such as communication plans and involvement of nurses in decision making. That is, we must provide an open communication environment for the nurses. Hence, they can work comfortably in the environment and they will also get a chance to take decisions according to their wishes and motivations. So the next strategy that we are going to discuss is about the recognition and incentives. The impact of recognition and incentive is that it motivates nursing staff, creating a culture that values ongoing learning and encourages participation. That is, recognition and rewards motivate nursing staff, creating a culture that values ongoing learning and encourages participation in development opportunities. That is, if the nurses are rewarded for their hard work and working hours, they will get more motivated, more confidence to do their work in a very decent manner, and hence by the patient will also get the advantage about this because they are utilizing more hours in the hospital setting, and the patients are also getting a good adequate care. Then the next impact is mentorship programs. The impact of mentorship program is that it fosters a supportive learning environment, reducing resistance to change and promoting the exchange of knowledge. That is, membership fosters a supportive learning atmosphere, and many mentorship programs where experienced nurses guide their peers in adopting skills and technologies. The examples of that are in-service education, continuous education. Hence, the nurses will get an adequate knowledge about the new technologies and changes that are happening in the science and the hospital setting, so they can utilize that skill in caring for the patient. And the next is the conclusion. So, by addressing these barriers and implementing strategic approaches, healthcare organizations can create an environment conducive to continuous nursing development. This not only benefits individual nurses in advancing their skills, but also contributes to the overall improvement of patient care and adaptability of healthcare systems to evolving challenges. That is, we must eradicate all the barriers and bring new strategies and new approaches to the healthcare organization, and especially for the nurses and the trainees, so they can do very well in their nursing field, and that not only benefit the individual but also the patients that they are providing care, so the patient will get an adequate care. So far we discussed about the topic, that is training for the employees, the introduction, the strategies, the barriers, the laws and regulations, and how to train a nurse, and what are the things that we should remember while giving training. So this is all about our topic, and I hope you all enjoyed our topic. Thank you and have a nice day. Thank you.